I actually went to medical school to become a plastic surgeon. That was my goal. My father's a plastic surgeon, and so I saw it always growing up. When I was about 12 years old, I went to see him in the operating room, and he was doing a lower eyelid surgery, a cosmetic lower eyelid surgery, and I just remember being totally enamored with it and thinking it was the coolest thing I'd ever seen. So that kind of set me down the path. The most important thing with anything in cosmetic surgery is that our goal is to make the patient feel more comfortable and more confident in their body. And so the first thing I have to do is, one, make them comfortable in the exam room, but two, figure out what it is they want to change. So it doesn't always matter what I see. That matters in terms of figuring out what we can do safely for them, but the goal is to make them happier. And so that's really what I try to accomplish in that first visit, is to understand what their goals are. When I set down this path to go into medicine, my goal was to be in a specialty, plastic surgery specifically, where I made people happier and I restored form and function to improve their quality of life. And so there is no more satisfying feeling than taking off somebody's post-operative bandage for the first time and seeing a big smile on their face. Because these are people that either have had something their entire life that they don't like, or they've aged in a certain way that they don't like, or they've had something taken away because of cancer or an injury. So to be able to put them back together again, make them look the way they want to look, is it's the greatest gift. It's such an honor to be able to do that. And so when I see a big smile on their face telling me that I've achieved their goals and it's a job well done, it's an out of this world feeling. My approach to taking care of patients, I consider myself to be pretty tenacious, in the sense that I won't rest until the patient's happy. And so when people come to me, it's my job to make them feel comfortable, to understand what they want to achieve, and then really my real work begins, and that's to achieve their goals. I hold the patient's hand through all of it. I make sure they're happy, and I won't rest until it's a job well done and the patient's content.